Good afternoon. My name is Paulo Villus. I talk about case 16 2016. A 31-year-old pregnant woman with fever. Presentation of this case: Dr. Prieto Bortoleto, Obstetrics and Gynecology. A 31-year-old pre-gravid woman was seen in the labor and delivery unit of this hospital at 35 weeks of gestation because of fever. Characteristics of the pregnant: the patient was pregnant with the ironic diamonitic twins, and her gestation was complicated by iron deficit, anemia, and hyperemesis. Approximately 3 weeks before this evaluation, make pruritus of the palms and soles development. Presentation video 1.
When 3-month-old Zoe and Violet Hannings are awake, they don't stop.
What a pretty smile, though.
But there was a moment early in Jen Hannings' pregnancy when her world stood still. During a routine ultrasound at 20 weeks, doctors determined the babies had a dangerous condition.
Surgery looked like the best option given the options that are available to you.
Zoe and Violet shared a single placenta, and blood vessels connected the two. Instead of blood flowing equally, Violet was receiving too much blood from Zoe. It's called twin-to-twin transfusion syndrome, or TTTS. The fetal heart muscles start to thicken, and valves begin to leak.
They can actually go into heart failure and die.
During fetal surgery, doctors insert a laser through the mother's abdomen to seal off the twins' shared blood vessels.
What the surgery does is really breaks the connections between the two fetuses, and so the transfusion stops.
In at least 90% of the surgeries, doctors successfully save one of the babies. 74% of the time, both survive.
She's out.
Doctors say the Hannings twins are now healthy and should continue to develop normally.
I think we'll just...
At 32 weeks, 5 days of gestation, 16 days before this evaluation, the patient was febrile, had no visible rash, reported fetal activity, but fetal hearts were heard on auscultation. A high-spot urinalysis revealed trace protein. A diagnosis of cholestasis of pregnancy was made, and Ursolde was administered. Presentation the video 2.
Well, cholestasis, a little bit like Group B strep, is a condition that people have become very interested in over the last 5 years or so. Strictly speaking, what cholestasis is, or obstetric cholestasis, is that in situations where a woman normally, and what that can translate into is bile salts being laid down in the skin and in other organs, how the liver is functioning in general, and specifically what level of bile salts there are in one's blood. So we make the diagnosis based on elevation of those things in one's blood. The way people became interested in obstetrics, I think, is first discovered in that way. One always immediately thinks there's a cause and effect going on, and that the liver abnormality has caused the stillbirth. Now, what always happens in medicine then is that more well thought out studies are done, whereby we look not at what proportion of stillbirths had problems with mum's liver, but where there are some problems with the metabolism of something like bile, then we don't feel able to take chances with a condition that we know is associated with increased risk to the baby. I think as larger studies are done, it may show that those risks are overestimated, and the natural follow-on from that would be that we weren't advising people to be induced at 37 weeks, which is my current practice. we may find that it's safer just to continue on with the pregnancy.
So, if
4 days later, at 33 weeks, 2 days of gestation, the patient reported persistent itching, nausea, and occasional voiding, along with a new pruritic rash on her abdomen that was thought to be consistent with pruritic urticaria papules and plaques of pregnancy. The results of the biophysical profile that the measured fetal well-being were reassuring. The patient returned home. Presentation video 3.
You had a question about cholestasis of pregnancy, and cholestasis is actually a condition that anyone can develop, but pregnant women are slightly more likely to get it because pregnancy changes the way our body works. Bile is made in the liver and it's stored in the gallbladder, and pregnancy can change the way that it's stored or how it flows through the gallbladder, and cholestasis if they feel like that's what it is. If this is the case, it has implications on the pregnancy. It can increase the woman's chances of having a stillborn baby. So if a pregnant woman has cholestasis, she will be monitored very, you can see it's itching in the blood from the buildup of bile acid. And most commonly it's itching on the palms of the hands and on the feet, and it's worse at night in most cases. And so the doctor will focus on helping the woman with the itching and then of course monitoring to make sure that the baby's doing okay until induction is indicated. If you have more specific questions about it, talk with your OB provider and they'll be able to give you tailored information and advice.
She reported nausea, decreased appetite, frequent urination, subjective fevers, and chills. She didn't report bleeding, dysuria, or loss of fluid. The patient's medical history included the presence of cycled cell triad, gastroesophageal reflux disease, and exercise included asthma, and she had dysmenorrhea and a stress fracture of her left tibia, Clostridium difficile infection after clindamycin use, and pancreatitis. Presentation video 4.
Used to treat infections such as pneumonia or to prevent infections associated with surgery. Many antibiotics are partially excreted by the body through the bile and into the small intestine, which in turn can lead to serious side effects, including diarrhea. Antibiotic treatment is a serious hospital-acquired problem that results in billions of dollars in healthcare costs annually. SYN004 is being developed as an oral tablet to be co-administered with IV antibiotics. SYN004 is intended to remain within the intestine and to degrade certain IV antibiotics that a healthy microflora from the overgrowth or with the IV antibiotic is to allow the SYN004 protects the gastrointestinal tract from the
Conclusion. The 31-year-old woman who was pregnant with the Aaronic demonic twins presented at 35 weeks of gestation with fever, rigor, malaise, myalgias, anorexia, and lost stools. A chest radiograph revealed patient right basilar opacities. Diagnostic test results were received. Presentation video 5.
Hi, my name is Larry Rand. I'm a high-risk. First piece of information you want to know, after congratulations, of course. Twin has its own placenta. That's a dichorionic twin pregnancy. If both twins need to share a single placenta, that's a monochorionic twin pregnancy. This takes us back to the very beginning, because there are two ways that you can end up with twins. entities, they each have their own amniotic sac, their own placenta, and basically are just experiencing crowding too. Splitting from 1 to 2 is quite an amazing thing and is how you end up with identical twins. What's really interesting, or quickly, and unfortunately, sharing a single placenta can pose quite a number of challenges. Imagine a two-family city or dichronicity. The twins have their own placentas or are sharing a single placenta. After this one placenta and how they actually share the resources in this one placenta. That's why it's critical that they're followed very closely with ultrasound.
Thank you for your attention.